I am just going to cover the planning model. There are more slides, there's more detail that going to encourage you to look at, but let's just look at the planning model because that's what's going to be the focus of your paper. So as you can see here, there are about 11 different steps. They include establishing the group's purpose, and each step has to be addressed in your paper. So you're going to look at establishing the group's purpose, assessing potential sponsorship and membership, recruiting group members, composing the group, what does it look like, orienting members to the group, contracting, preparing the group's environment, reviewing the literature, selecting and monitoring evaluation tools, preparing a written group proposal, and planning distance groups. So let's get started with the purpose. This is the first thing that needs to be put into place. It's the most crucial thing because it drives the group. It drives the group's direction, what goals you should have, the types of members you want to recruit, everything. So you want to establish a purpose that's broad enough to encompass the individual's needs and the individual's goals, but not so specific so that it eliminates people's ability to recognize or realize their goals within that. So think about Nancy's situation. Think about the type of a group that Nancy wants to run and make some suggestions to her based on your definition that you provide for her of the group's purpose. And that purpose is generated in a lot of different ways. You could have a purpose that is generated from a group-centered perspective. So the example is used that the worker might want to see an educational group for children because of their caseload, etc. It could be agency-centered. So more than one worker gets together and talks about their caseloads and how they might come together in terms of, we talked about remedial groups and what that looks like. So Nancy might want to have a group that combines more than one caseload. You have member generated, right? So parents and what they're doing. You have community generated, right? So when you're talking to Nancy about the group's purpose, break it down. Identify where her group purpose is going to be generated from. Is it going to be group-centered, members generated, agency-centered, etc.? In terms of sponsorship, there has to be a fit between the agency and the clients. And so sponsorship is primarily determined by what are the resources that this agency can provide. And that's not just monetary resources, it could be in-kind resources. But what is it that the agency can make available to the group? It might be that you might tell Nancy that the Harrison agency might not be the one, that that she might need to look elsewhere. So if that's the case, you need to make sure that she understands that there are different policies and procedures and practices that need to be put into place on the part of the agency. But again, you're wanting to look at what's the organization or the agency's policies and goals, and how does that fit into the purpose of the group. So then you're looking at what is the problem that's going to be the focus. You have the purpose, now you're looking at the problem. And you're looking at making sure when you address or identify the problem, the potential members have a shared perspective of what the group is going to be about. So you're proposing the group. you're talking to Nancy about the purpose of the group, but now it's important that the members, potential members, buy into that. You want to look at cultural and other differences that are going to influence the way in which the group members perceive the group or perceptions about the purpose of the group. Please, please, please go back to the composition of Nancy's caseload. You have specific people that have specific ethnicities and backgrounds. When you're talking about membership, talk to her about that. It's important that you talk to Nancy about the fact that there needs to be an understanding of how the members perceive this sponsoring organization. Is it something where they feel that it would be beneficial or not? So in terms of if you're working with mandatory members, you really need to get some training, some background, etc. on that. Look at demographic differences and commonalities because you need a combination of both in order to make the group work. So there's potential benefits to the members of participating in the group. Talk about what are some of those benefits based on Nancy's scenarios. There can also be barriers and obstacles based on Nancy's potential group. What are those? There's probably going to be resources that are needed from within the agency and also resources from the community that ensure that there is a chance that the group will be successful. If funding is a component of the resources, look at the guidelines and mandates that inform the way in which funding sources are made available or allocated. So assessing the potential membership, determine potential members in terms of your perception if they're able to work on the tasks that are facing the group. You should gather information about potential members in terms of recognizing the need for the group, recognizing its purpose, the tasks, the goals. It's important, once again, how do potential members perceive the sponsoring agency? And what attractive qualities does the agency have? And what obstacles do potential members see? So when you're considering sources for potential members in terms of recruiting, it's important to look at different sources that the members can be identified from. There's colleagues' caseloads, there's records, there's mailing lists. Also consider reviewing the agency's waiting list. I come back to this with Nancy's situation because you can't necessarily assume that the 5 women that she's identified are going to just be the ones that she works with. Talk to her about recruiting techniques. It's important. It's most effective to recruit in person or with direct contact. It's important if Nancy's looking at other cultural groups, and we've talked about cultural humility and what that means and how you approach people, she looks at and interacts with and understanding that trust is so important. Spend time in the community that the potential members might be coming from. So you want to target a potential pool of group members. Depending on the type of a group, depending on the way in which Nancy wants to configure her group, it might make sense to do some mailings, phone calls, that type of thing. It could be that she can go on the agency's website, commercial television and radio, that's kind of dated, but we can talk about that. Television, just different ways in which she can get the word out. But in doing the recruiting, making sure that she's careful to include the criteria that she's looking for members of the group. So when we look at group composition, it's always important when you're looking at the composition of a group, it's important to have homogeneity, right? So that the purpose for the members being there, personal characteristics are pretty much on par. They're there for, they look the same or similar, right? But then you have heterogeneity of membership. So that's in terms of being on a different level in terms of coping skills or life experiences and expertise. Go back to the members that Nancy has identified. You have some information about them. Talk to Nancy about them in terms of the group being heterogeneous and also homogeneous. And then you have complementary overall structure, and that's the range of members' qualities, skills, expertise, the things that they have to achieve a sense of equilibrium of members so that you can have some assurance that the members can work well together and help each other to achieve individual and group objectives. So let's dive in a little bit more to homogeneity. First of all, the homogeneity comes from the group's purpose. If members resonate with that group's purpose, then they're on the same page. You want potential members that are on the same page with that. Some personal characteristics must be in common. If you have people that are aggressive mixed with people that are more passive or quiet, it might not work. So you want to look at the personal characteristics. Nancy has the benefit of knowing these women, knowing their personal characteristics. So you want to make sure that the homogeneity surrounds or contextualizes opportunities for good communication and bonding that leads to that cohesion that we're able to, that we really want to achieve. So members need to be able to have some empathy or compassion to be able to relate in some way with their fellow members. So the purpose provides that common basis for interaction. So some of the things you're looking for is age, level of education, cultural background, expertise relative to the group task. So that's for task groups. So once again, invite Nancy to look back at the potential members that she is interested in working with to see if they have those things in common. So common characteristics vary with the type of the group. So these are some of the things that go into looking at homogeneity within the group. Heterogeneity, you want some diversity of the members. If you have too much homogeneity, sometimes there aren't those opportunities to really grow as group members, to, ask questions, to dive in there, that type of thing. So looking at coping skills, life experiences, levels of expertise, those types of things are important and components of heterogeneity. Especially if this were a task group, you would definitely want to look at heterogeneity in terms of looking at who best is equipped to address what aspect of the task. So complementary group structure. Communication is an essential part of the group. So you're looking at how well group members are able to communicate with each other. Can they accept or even tolerate each other's behavior? Can they accept or tolerate differences of opinions, viewpoints, and positions? And then there's some intrapsychic or internal insight that they need to be able to do to understand their own behavior as it relates to others. And they are open to sharing their experiences but not just hogging the floor, but also listening to others. Once again, look at Nancy's group to see if that's a possibility. If there isn't good communication, people can become antagonistic. They're not willing to support one another. They're not willing to participate. Then you have the challenge of people that are, once again, overly aggressive, highly opinionated. They won't even consider other people's viewpoints. They may not make it for group. Group might not be suited to them. It might be that they need to go into individual counseling. But that whole idea of being agreeable, cooperative, having openness is so important to solidify a healthy group structure. So, in terms of age, you want to look at um, like not having maybe too much of a range. If you look at Nancy's caseload and you look at who all the age range for the group members, potential group members, they may not all, you know, they may not all fit in. If there's a significant variability within ages, that can be a challenge. If there's a relatively wide range, though, there's opportunities for multiple experiences to be shared about their environment, um, and also sharing about family, peer group, and culture. Remember, we talked in previous chapters about the importance of establishing group culture, which comes from the individual group members' cultures, combining those, finding the similarities, and identifying culture from that. There can be some differences in terms of gender composition. It looks like Nancy's caseload is primarily women, so you want to look at that. Are there more commonalities or differences that you need to address? Level of support, how does that get addressed? If you have common sociocultural backgrounds, so are all of the women coming from a similar or the same in terms of sociocultural background? So once again, when we're looking at heterogeneity or complementarity, um, it's important to look at the whole picture in terms of members' strengths. Because remember, as social workers, as group leaders, we're coming from that strengths perspective and empowerment practice. But one of the things, and this was on your quiz, be sure you talk to Nancy about having just one member of a minority group in the group can be catastrophic. It can be a setup for failure for that one group member. So she needs to really consider that um, as part of the group composition. Size issues vary. Um, on the one hand, there's that broad recommendation that you just have enough members needed to accomplish the purposes or the tasks and to do it efficiently and effectively. This works very well with task groups, right? Um, but also with treatment groups in terms of considering how the members might be affected by the size of the group. Will the members feel like they have been able to capture sufficient attention to have you address their concerns? Their larger treatment groups can offer benefits in terms of um, more opportunities for Indigenous leadership to emerge. Um, could be more opportunities for role modeling to occur, that type of thing. If you have quiet members who like to just listen, um, there are those opportunities. There's less pressure to speak. The disadvantage is that you don't get as much one on one. There aren't as many opportunities for face to face interactions, We talked about subgroups before and the fact that subgroups can be beneficial. In fairly large groups, they can also be harmful. They can distract or detract from the purpose of the group. There could be those silent members that feel devalued or not heard, or other things. You could have members that are absent more frequently, or they're absent and their absence might not be noted. Larger groups, I'm talking 20, 25 people, it could be unwieldy, it could be difficult to manage. And with a large enough group, the one thing we're moving towards is cohesion, and that's the one thing that can be difficult to achieve when you have a group that's too large. So for a task group size, larger groups are great because there's more synergy, more opportunities to toss out ideas, et cetera, in terms of complex tasks. They can be achieved more effectively. Once again, though, it depends on the purpose of the group and the needs of the members and how they're able to contribute. You have open and closed membership. So we're still talking about that composition. What does the group look like? We know that open groups are ones that don't have a stop date, that they can't continue on, and group members come and go. So there's a flow of group members that come in and out of the group. Whereas closed membership, and this is what I'm thinking Nancy's going to, it's something that you want to suggest to Nancy. Talk to her about open versus closed group in relation to the purpose of the group. What is the purpose of the group? So the example of a treatment group based on in a residential treatment facility, and they add members as they're admitted to the facility. So that makes sense that the group is driven by an open conception. So, right, open members you can add periodically. The size can remain the same as members come and go. And they're able to enter and exit throughout the life of the group. It can be closed groups make more sense. With open groups, it's hard to achieve cohesion. Communication looks different with open groups. With closed group, there are better opportunities to establish healthy group dynamics. In closed groups, you can move more quickly through the stages of development to the middle stage, which is your working stage. You get more accomplished. With open groups, the group might never get past the beginning stage because there's so many members coming in and out. Okay, yeah, disadvantage of the closed group. Tell Nancy, once you have those 5 or 6 or 7 group members, if it's a closed group, if somebody drops out, you cannot let another person in. That means that the viewpoints and the skills, et cetera, that the members bring with them stay the same. I mean, you work on improving them and changing them, but you're not going to get new ideas and viewpoints from new members. Sometimes open membership works better. They bring new resources. They can change the actual nature of the group, not the purpose, but the nature of the group. And it's easier to add members because that's just a part of the process. So I want you to read more about open and closed groups. There's a little bit more. Orienting the group. So there's the intake interview. Even though Nancy knows the potential members, you still have to orient the group members, the potential members, to the group. They might be familiar working with Nancy one-on-one, but now they need to know what to expect as being part of a group. So that often takes place through the intake interview. So if Nancy has somebody who she's not familiar with, who she's recruited for the group, it's an opportunity for Nancy and that potential member to get impressions of each other, to find out, is this going to work or is it not? So sometimes orientation with new members in a task group looks different. So in the orientation, you want to make sure, and this is not the only time, you want to bring up, notice through the steps, we keep coming back to the purpose of the group. You need to make sure you remind Nancy, as well as potential members, what is the purpose of this group. Orienting means also familiarizing the group members with what are the procedures, right? And here's where you screen members for appropriateness. You might have, you might want to do a group for women with bipolar. You have one potential member that you're trying to recruit, and you realize that she's not stable. Her meds aren't working, or she's not managing her meds right, or something like that. And that's not the type of a member that would be appropriate for the group. So you're screening your members during the orientation process. Once again, explain carefully the purpose of the group. So when you start out talking to Nancy about the purpose of the group, make sure that you are thorough in your discussion. Once again, group procedures, it's important that they become familiarized with, and to do as much explaining as possible in terms of participation, how the group will proceed, et cetera, because you don't want someone to sign on and then they get into the group and they are flabbergasted. There's nothing about the group that you talked about. So once again, screening members is you want to make sure that there's a match between the purpose of the group and the characteristics and the personality of the group members. And also making sure that you as the worker are able to look at and get some impression of the group, the potential group members. There's some things that might not make sense in terms of being a group member. Otherwise, they might be a good fit, but there's problems with transportation, there's problems with childcare, things like that. So during the orientation or during the planning session, before you get to the orientation, Nancy's working with, her caseload are women who have children, they're moms. So Nancy needs to address that in planning the group. What is she going to do about childcare? Is that something that is going to be an issue, or, how does it take care of? Is that something that agency resources can help with? Then you have contracting. It is, it's formalizing, it's solidifying the relationship between the worker and the members. And it usually happens during the beginning stage of the group, but contracting is something that can also happen during the planning process. And what Toslin and Rivas talk about with contracting is a written or a verbal agreement between two or more members of the group. So here where it talks about contracting, you can insert your informed consent form that you created, or you can just talk to Nancy about, in general, what does contracting mean, and then refer her to later on when you get to the end where she could see the informed consent form, which is an example for her. So in terms of contracting, there's contracting for group procedures. Once again, what needs to be in place, the duration of the group, the type of group, the time of the group, all of those things, those group procedures have to be there's got to be a contract about that. And then contracting for individual member goals. So in coming into the group, members have an idea of what they want to work on within the context of the overall purpose and the overall goal. So, right, duration, attendance, confidentiality. You really want to talk about the confidentiality and any other things that need to be taken into consideration. Most treatment and task groups have a verbal agreement. However, oftentimes it can be useful to have a written contract because it clearly outlines what the group's purpose is. And it's something that can be referred back to once the group gets started. There's more that you need to read about contracting. I'm just hitting the highlights. I'm expecting you guys to go through this with more detail. Preparing the physical setting. You want to attend to room, size, space, seating arrangements, furnishing, atmosphere, etc. If you have a room that's too small, then people can feel uncomfortable. You want to, first of all, the ideal setting for a group is in a circle so people can face one another, they can see each other, that type of thing. But you also want to make sure that there's spaces between seats so people can observe and feel comfortable that their personal space isn't being violated. So you also want to make sure that the room is relative to the size of the group. If Nancy's only going to have 7 people in her group, she's not going to get the auditorium. She could get a conference room, something like that. But the auditorium, there's more room for distraction. Make sure she attends to special needs. For example, if one of the women she's working with has diabetes and it's the evening and she needs to make sure that she keeps her sugar up, Nancy needs to make sure that that's a part of the physical environment. And for folks that have physical disabilities, so you're paying attention to those things. In terms of securing financial support, it could be that there's a lot of need for financial support from the sponsoring agency. It could be that you just need the meeting room, or you just need to acquire supervision for the group leader. Review the literature. Now, I can't stress enough at this point, when you talk to Nancy about reviewing the literature, it's reviewing literature on groups. Do not encourage Nancy, because she already knows. She's been working with women with bipolar disorder for several years now. She doesn't need any more literature about bipolar disorder. What she needs literature about is groups, working with groups of women with bipolar disorder, right? So, and if she can't find that, find information about working with groups of women with mental health issues, right? That are parenting. So that whole thing. But don't steer her towards literature specific to the diagnosis, because you're missing the boat with her. And this shows you the types of literature searches that she can do. So I expect to see these in your paper too. Monitoring and evaluation tools. Nancy needs to know how she's doing, how the group is doing. Are they meeting their milestones? Are they going in the right direction, etc. So she needs to be able to monitor the group, and it could be recording, or it could be that she takes notes for each session. She can also encourage, as the group gets going, for members to monitor themselves. But it's important that she makes sure that members are constantly tracking with their goals. So this is important. She's going to want to make sure that she has it fit in so that members are tracking with their goal so that they're able to realize their goals. Then there's a written proposal. So even though Nancy works for the Harris Agency, she's not necessarily going to be able to have a casual chat with a director who signs off just based on the conversation. Director might say, you need to send me an email with a formal proposal, right? And that helps in terms of if the agency is giving any resources, space, et cetera, it's documented what that looks like and for what reasons, the justification for that, right? Written proposal is also important to use in terms of letting potential members know about the group. So if we bump back up to the recruitment level, the recruitment stage, we're looking at the importance of a group proposal there. And once again, a group proposal is not this whole long, report. It's 2 brief pages at most. It's summarizing the group. But the most important thing you've got to put into your group proposal is the purpose of the group. That's what drives the proposal. You might be planning, it might be that Nancy is considering planning a distance group based on the logistics of the moms getting home and, not being able to get childcare, however that works. So it does act as an important alternative to face-to-face. It is, it's good for folks that, once again, if there's transportation, childcare, etc. So in rural areas, it might be particularly important. People that have hectic schedules, or they only have a certain amount of time. For those who have social anxiety or are profound introverts, distance might work. So some distance groups can really function well, and people are really motivated to be in them. The disadvantage is you're not able to really track. You as a leader are not tracking with the your group members from the waist down. All you're seeing is from the chin up or the neck up, that type of thing. So some members might be challenged to be able to participate in a healthy manner. There might be hostilities that form. It could be that there are emotionally charged topics that come up that trigger members of the group. So once again, not having those visual cues makes it more challenging, and people can project negative meanings onto messages that were intended to be positive. And if we go back to the chapter on communication and what encoding and distraction or distortion and then decoding looks like, it can be a whole mess when it comes to distance groups. So I want you to read the rest about planning distance groups. What if you are going to suggest that Nancy do a hybrid group? You're suggesting that Nancy sit down, get a room assigned, and have some women in the room present, and she brings in the technology to have the rest of the women online. If you are going to do hybrid, you need to tell Nancy how she's going to set up effective patterns of communication, effective group dynamics when you have one part of the group online and the other part of the group in person. Toslin and Rivas don't talk that much about hybrid groups because they can be challenging. They can be challenging to do. Okay, these are the steps for the planning model that appears in Chapter 6. And I've been trying to go through with you for every step examples of how you want to discuss it with Nancy. You can do this assignment in the first person. I've had students that talk to Nancy, in conversational tones as they're talking about the definition of the different stage. Other people prefer more formal. But for every step of the way, you're not just talking about the definition, but you are applying the definition to Nancy's situation.